Ventricular system of the central nervous system. Here first we see the two lateral ventricles. These are the two lateral ventricles that lie in the cerebral hemispheres. First we have the body. This is the body of the lateral ventricle. These two, the body. The bodies lie in the parietal lobe of the cerebrum. This is the frontal horn. Here we see the frontal horn of the lateral ventricles. It lies, or the anterior horn. It lies in the frontal lobe. Behind we see the posterior horn of the lateral ventricle. It lies in the occipital lobe, and here we see the inferior horn of the lateral ventricle. This is the inferior horn of the lateral ventricle. It lies in the temporal lobe. It lies in the temporal lobe. The two lateral ventricles are connected together by the interventricular foramen of Monro. So these two are the interventricular foramen of Monro, sometimes called. And they are connected to the third ventricle. It's a slit-like cavity. This is the third ventricle. Here, see that? That is the third ventricle. The third ventricle. And the third ventricle also is connected to the fourth ventricle. This is the fourth ventricle. It is connected to the fourth ventricle via the cerebral aqueduct of Sylvius. This is the cerebral aqueduct of Sylvius. Here, third ventricle, cerebral aqueduct of Sylvius. This is the fourth ventricle. And the lateral ventricle lies in the cerebral hemisphere. The third ventricle lies in the midbrain. The cerebral aqueduct passes through the third ventricle is between the two thalami in the diencephalon. The cerebral hemisphere passes through the midbrain. The cerebral aqueduct of Sylvius, sorry. The cerebral aqueduct passes through the midbrain here, and the fourth ventricle is in the hindbrain, between the pons medulla and in the cerebellum. And here we said this is the interventricular foramen, but here this is the interthalamic adhesion. This is the interthalamic adhesion. The two thalami adhere here. From the third ventricle we see 4 recesses, anteriorly 2 and posteriorly 2 more recesses. Anterior recess, this is the infundibular recess. So this is the supraoptic recess, sorry. The supraoptic recess, this one. And this one below is the infundibular recess. Behind this one is the pineal recess, suprapineal recess. And the one below is the pineal recess itself. So here we see supraoptic, infundibular, suprapineal, and pineal. For the fourth ventricle, if you see it from behind, this is the fourth ventricle. It has 3 projections. These two, laterally, they're called they head to the foramen of to the two foramen of Luschka. These two, they head to the foramen of Luschka, and this one in the middle to the foramen of Magendie. Luschka, Magendie. And below it continues down as the central canal of the spinal cord. So regarding the fourth ventricle, we said here, these two on the lateral sides, they open back into the two foramen of Luschka, these two, to the foramen of Luschka. In the middle, it drains back into the foramen of Magendie, to the foramen of Magendie. And the fourth ventricle continues down as the central canal of the spinal cord.